Great, well, good afternoon. I want to start by asking you a question, and that's how many of you have heard of the disease guinea worm? Please raise your hands. Not too many. It's not surprising, because although guinea worm is an ancient disease chronicled by Greek writers as far back as the 2nd century BC, it's a disease that's long ago been eradicated in rich countries. You get the disease by ingesting water that's infected with the worms of with the eggs of guinea worms. And once inside you, these eggs can grow to be up to 3 feet long. After about a year, the worm makes an agonizing lesion in your skin as it slowly emerges from the body. And this is a process that can take more than a month. So imagine that. There's a worm that's 3 feet long, creating an incredibly painful lesion in your legs, emerging from the body. You can't walk, so you can't work. You can't go to school. And the pain is so agonizing you can't concentrate, so you can't read a book, you can't carry on a conversation. And you have to sit there, lying for a month, waiting for this worm to fully emerge. About 5 years ago, I was part of a delegation that traveled with the Gates Foundation's Global Health team to West Africa. We were traveling in the region looking at some of the programs that we were funding. And one in northern Ghana was a program that we were funding with the Carter Center. And the Carter Center is an institute that was started by the former president to address global health. They were working in the region to try to eliminate guinea worm. So part of our visit included a trip to this clinic where representatives from the center would take care of kids during this torturous extraction process. They would look after them and try to provide what comfort they could during the month or so where they had to be there and help uncoil this worm every day a few more millimeters at a time. And while I was there, I met a child who was about 6 years old, roughly the same age as my son at the time. And this boy was incredibly brave, because although he was in near agony, he talked excitedly about the day that he could finally rejoin his family, return to school to resume his education. And this experience really jarred me. It jarred me because although I had seen firsthand what happens when you don't have access to decent health care, you've seen what happens to communities in those cases. It was one of the first times that I traveled to the developing world as a father. And so I tried to imagine what it would be like if it were my son that were being treated for guinea worm in that clinic. What it would be like as a father to watch helplessly as one of your children were in agony for a month, all because of lack of access to clean water. But the story has a happy ending, and an ending you might not expect, because the folks at the Carter Center realized a pattern of infection. They saw how when people infected with guinea worms, to ease the burning sensation of this emerging worm, would plunge their limbs into water, and that would trigger the guinea worm to release more larvae into the water, which other children might drink, and repeat this cycle all over again. So they created these ingenious pumps, very inexpensive as well, that resemble something like a Stairmaster, that would, when used, filter the water and prevent infection from guinea worm and other kinds of parasites. And you can see what happens when children have clean water, then they weren't getting infected. And we were seeing already what was happening in that community as a result of the Carter Center's investments there. And it's worked. Since 1986, when the Carter Center first started working on guinea worm elimination, they've been able to reduce the numbers of infection from about 3.5 million children, roughly in 21 countries around the world. They've reduced it by 99%. And this year alone, the number of new infections has been about 150. So we stand on the brink of one day, very soon, being able to eradicate this disease entirely from the face of the earth, which would only be the second time in human history, behind smallpox, that we were able to do this. Now, I tell this story for two reasons. The first is that it's a moral outrage that millions of people continue to suffer needlessly from infections and diseases that have long ago been wiped out in places like the United States and the UK. But the second reason is that most people haven't heard of these success stories. They don't know, or worse, if asked, they would say things are not actually getting better. So because of this, the Gates Foundation has invested heavily in efforts to try to increase the amount of visibility that's paid to what's going on in global health, and to really shine a spotlight on what has made a lot of these successes possible. And there have been a number of reasons for the successes that we've seen. Countries are improving their economic development. There's better infrastructure. There's more affordable access to new drugs. But there's been another indisputable factor, and that's the generosity of donors like the UK, the US, others, and by extension, the citizen taxpayers in those countries. So for this reason, as head of the Gates Foundation's European office, I spend a lot of time working in government ministries, trying to make the case to policymakers that the small amounts of money that go in their budget to international development assistance, which is commonly referred to as aid, is having a remarkable impact in the lives of millions of the poorest people around the world. And that even in these tough times, even when circumstances are so dire, they can still afford to maintain these commitments to fighting global poverty. And what these policymakers will tell you is they agree, but their constituents don't believe it, so they can't vote for it. They say that their constituents think that aid is ineffective, or that charity starts at home, and that's especially true when times are tough. So if politicians don't think that aid is a priority, and aid is put on the chopping block, we risk derailing much of the progress that we've seen in recent years. So the question is, why do people think aid is ineffective? And why is it too expensive? Well, part of the reasons may be obvious, because many of the images that people see and read about in places like Africa are pretty bleak still. It paints a portrait of a continent where nothing good can happen. They don't talk a lot about the successes that we're seeing. They don't talk about the fact that a majority of the top 10 fastest growing economies in the world are based in the continent of Africa. But the other reason, perhaps, is less obvious and is based more on just plain misinformation. I want to show you a video now that was done by an organization called One, which asked people on the street in the UK how much they think their government spends on development assistance and what's been achieved with that.
So what do you think about spending on overseas aid?
I think we do too much of it, to be honest with you.
I think the UK spends a lot of money overseas and maybe they should spend
Start
some more
at
here.
Spending on overseas aid, I think is positive. I think you've got to help everyone. I don't think we should think just about our country. I think it's about helping the world generally.
We have enough problems here without this overseas business.
What percentage of Britain's gross national income do you think is spent on overseas aid?
Ooh, I would say about 15%.
10%.
Probably around 10%.
About 20% maybe.
I'd say about 20%.
30%, 40%.
Majority is maybe 60-70%.
I haven't got a clue.
What would you say if I tell you it's less than 0.7%?
Do you always tell lies?
It's nothing, it's not much.
I would have thought it was more, but if you say that, I do believe you.
Nah, that's wrong.
And how many children's lives in poor countries do you think vaccines have saved in the last 10 years?
A lot.
You're probably looking into hundreds of thousands.
20,000 maybe?
15,000.
200,000?
The number of kids saved by vaccination in the last 10 years is 5.4 million.
Wow, that's really good. That's impressive.
5.4. That's excellent.
That's brilliant. That's really good.
How many more children in poor countries do you think have been able to enroll in school over the last 10 years?
I would probably put that at about 50,000, if that.
Tens of thousands.
That's a tricky one.
Yeah, probably 20,000.
The number of kids enrolled in school was 46 million in Africa alone.
That's good news. That's good news.
Shock, horror, surprise.
Incredible.
How many again?
46 million in Africa alone.
Can I swear?
They should do more to show that though, because we don't really see that.
So what's your message to the government now?
Get your hand in your pocket.
My message to the government is keep giving aid. I think 0.7% is, we can probably all afford a little bit more.
Increase the spending. If that's what we can achieve on 0.7%, just think what we could achieve if we did increase it.
By giving more, you can help more and more people.
They need help. We're the people who can do it, if we choose.
The message is clear that if more people knew what is undeniably true, and that's that aid represents a tiny portion of government's budgets and that much of it is working, then they'd be more inclined to support it. Now, I mentioned that another thing that people often cite about aid is that it's ineffective. And to me, that commonly translates into this notion that aid delivered from rich countries to poor countries often ends up in the pockets of corrupt dictators who use this money to buy mansions and new cars. And it's true that there have been a lot of cases of aid misused over the years. But it's also true that a lot of the aid dispersed before, say, around the year 2000 was oftentimes not focused exclusively on poverty alleviation. In fact, it was used to try to forge political alliances and to try to buy access to a country's natural resources. Today, we know a lot better about what works and what doesn't in aid. And let me give you just one example. There's an organization called Gavi. It was set up in part with the Gates Foundation support about a decade ago. And the purpose of Gavi is to make sure that all kids everywhere have access to life-saving vaccines. The way it works is that countries can apply to receive money to buy and distribute vaccines. And Gavi is efficient. It's efficient because countries have to prove in their applications that they have the systems in place to deliver these vaccines. It's efficient because corrupt dictators don't typically stockpile vaccines. It's really efficient because Gavi buys at such a high volume that they can really bring the prices of these vaccines way down. So we should all be really proud to be supporting organizations like this. And the results have been impressive. You heard in the video, in the last 10 years, more than 5.4 million children's lives have been saved as a result of the work that Gavi is doing. There's another statistic, though, I want to show you. It's the one that we obsess about more than any other in the Gates Foundation. And it's the number of kids who die before their 5th birthday. And as this graph shows, we've made incredible progress on this in a relatively short period of time. In 1960, about 20 million children lost their lives before the age of 5. And today that number's been brought down to about 6 million. Now you might say to yourself, if we're saving all these lives, aren't we just putting added stress on overpopulation? And while that might seem the case, the truth is, when you reduce child mortality, when families know their children will survive, they choose to have fewer babies. We've seen this to be the case in the UK and other European nations, where our great-great-grandparents typically had much larger family size than is the average today. But let's use the same graph to show what would happen if we interrupted the pace of progress that we're making. Using some really advanced modeling that has been done by Johns Hopkins University, we can actually show what would happen if we stop providing life-saving things that we know will help children under 5. You can see that this pace of progress would be interrupted, and it would in fact start to reverse over the next few years. But then using the same methodology, these researchers looked at what would happen if we increased our access to children under 5 with 5 basic, simple, inexpensive interventions. And I'll show those to you. The first is childhood vaccination. If we increased childhood vaccination, reaching more kids in the poorest 66 countries of the world, we could save 500,000 lives every year. But then we'll add other interventions, and you'll see that the progress and the potential is astonishing. If we treat more kids with malaria, the line goes down even further. Childhood nutrition, neonatal care, which includes newborn care as well as safe delivery for mothers. And then finally, prevention and treatment of diarrhea and pneumonia, 2 of the leading killers of kids in the developing world. And the picture you have here is pretty dramatic, because what it says is that by 2025, if we provide access to these 5 simple things, we can prevent the deaths of 2.7 million children every single year. And more astonishing is the total number in that period, nearly 19 million children's lives saved by 2025. So this is too big an opportunity for us to pass up. Now, I don't want to leave you with the impression that aid alone is the answer. Countries ultimately have to be able to sustain funding for issues like agriculture, like health, and ultimately wean themselves off of aid. And we know, though, that aid can play a helpful role in putting countries on the path to independence by breaking the vicious cycle of poverty and disease. And we've seen what happens in South Asia, where countries have gone, in some cases, from being an aid recipient to an aid donor in less than 50 years, and the role that aid had in helping countries along the way. So what I think stands as the biggest obstacle to achieving many of these goals is public apathy. Or put another way, if more people could see the impact that aid, when invested well, is having, and how it's contributing to a record decline in things like childhood death, they'd be much more excited about the progress and the potential in the future. And if the same people demanded of their governments that they at least maintain these commitments, if not improve or increase the contributions in the future, then politicians would feel much more accountable to their citizens. Now, I want to leave you with a couple numbers, two numbers actually. They're actually save the dates. The first is September 15th, 2015. And that's the date when leaders will come together in New York at the United Nations and take stock on the progress of the so-called Millennium Development Goals, 8 targets that were set in the year 2000, agreed to by the leaders of 189 nations. And while we still have 2 years to go on the Millennium Development Goals, the MDGs, based on the progress we're seeing, it will be a moment for the world to celebrate. But it will also be the same day as leaders start to agree to a new set of goals that will guide the next 15 years in the war on global poverty. Now, my inclination is that leaders won't be naturally signing up to bold and historic commitments. They won't want to make big new financial pledges. But if these same leaders felt a sense of urgency amongst their constituents, that this truly was a historic moment, one that was too big to pass up, then they might just sign on to the ambitious but very achievable target of eradicating extreme poverty by the year 2030. And that's the next save the date I would give you. Because 2030 should be especially important to the parents of kindergarten students here. 2030, if all goes according to plan, is the year that your students, your children, will graduate from college. And what a great graduation gift it would be to say, that's the year that the world ended extreme poverty based on the collective actions and decisions we took in 2015. Thank you.